Begin.
Hello, it's exam. It's Peter James, your number 12345. May I proceed?
Yeah.
Hello, I'm Peter, one of the doctors here in this department. Am I talking to Julia Black?
Yes,
Mrs. Julia
doctor.
Black. How
Yeah.
would you like me to call you today?
Oh, Julia's fine.
All right. Can I confirm your age, please?
I'm 80.
Okay. I understand that you were admitted in the hospital for a while for an infection down there. Is that right?
Yeah, I had an
Yeah.
infection in my waterworks, and
Mm.
yeah, I'm about to go home, doctor.
Yeah. Well, that must be very exciting, isn't it?
Yeah, it's very exciting, but I had very bad fall.
Yeah, it's unfortunate
Yeah.
to what happened. Okay, I'm just here to check up on you and see what really happened. But how was your hospital stay so far? Is everything okay?
Yeah, it was good. It was good, but
Mm,
yeah, apart from this fall. Yeah.
And how about your infection? Is everything okay?
Yeah.
Okay, that's good to hear. So, would you tell me a bit more about the fall? What happened? Did you by any chance trip?
Most probably I tripped over. I was just going to the toilet and then just tripped and went on the
Mm,
floor.
so, what was the floor slippery? What happened?
No, doctor, I don't know. Maybe my leg gave way. I'm not sure what happened, or just
That's very
went
unfortunate.
down.
Um, is everything okay? Did you by any chance hit your head?
No, at all. No, doctor.
Okay, that's good to hear. And before this happens, did you have any heart racing?
No, at all. No,
Any weakness or numbness anywhere?
at all. No,
Yeah. Okay. And when this happened, did you lose consciousness?
no.
All right. And after this happened, did you remember and regain everything very clearly?
Yeah. It's just, I tripped over, doctor. I didn't have any symptom, any problem at all. It's just,
Mhm. Okay,
yeah.
that's reassuring. And how are you feeling right now? Is there any pain anywhere?
Yeah, I have pain. Yeah, I have pain in my hip. Yes, doctor.
I'm really sorry about that. Is there any swellings or bruises?
I don't know. I didn't see.
Mhm. Okay. We'll check on that as well. So, going to your general health, do you have any medical conditions?
No,
Any
no,
medications that you take at the
no,
moment? Okay. Do you have any specific allergies?
no.
Okay. It seems that you've been through a lot of stuff actually. Having an infection and being discharged and just about getting discharged, you fall down. I know it's difficult.
Yeah.
But I'm here with you to support you throughout this. So let's just hope for the best. Do you have someone with you, or are you here on your own?
Well, my daughter is just coming to pick me up.
Okay, so you've already called her.
Yeah, the nurse called
Oh,
my daughter and told her to come and pick me up.
oh,
Yeah.
all right. Okay, so do you usually independent or do you need help?
No, I'm doing everything by myself.
Okay, that's good to hear. And you're usually mobile?
Yeah.
Okay. So I would like to examine you. I would like to check your observations real quick, your heart rate, breathing rate, blood pressure, temperature, and oxygen level. And I would like to have a look just at where you fell, and especially your hip, because you said it's painful. Would that be okay with you? We'll maintain your privacy. We'll have a chaperone. So can we proceed?
Yeah.
Okay. Now, before we discuss further, is there any concerns that you have at the moment?
I just need to go home, doctor. Don't tell me that I do have a problem because I want to go home.
I understand. Mhm. Okay, so after examining you, we've just noticed that your right hip, like you said, is a bit tender and it's a bit kind of bit out of the place. So we just want to have another look and order an X-ray to look at the joint and see what's going on, because it's can be a bit concerning to us. So what do you think about that?
What do you mean by concerning, doctor? What are you concerned about?
Well, I'm just worried that the fall may have uh, caused you a dislocation or a fracture. So we need just to do an X-ray to rule out anything serious. I
Oh
know
my
it's a
God,
bummer.
doctor. No, doctor. I am. Uh, it's just some pain in the hip, doctor. Don't tell me that I have a problem, doctor, please. It's, I don't think this is serious, doctor. Please, just let me go home, please.
I can see that you're really upset about this kind of news, and it would be really upsetting if you're anyone in your place would feel the same way. But your health and your safety is my priority, and this is what we aim for, what we aim for. So, just to make sure that everything is okay, we'll keep you here, keep an eye on you, and make sure that everything's fine. And if there is anything, the orthopedics team would immediately take action, so that we prevent any further complications. What do you think about this?
Well, it's just pain, doctor. It's just pain. Just give me painkiller and everything will be okay.
Uh, of course, we're gonna give you painkillers and we'll try to support you throughout this. You'll not be alone. We'll try to make you feel as comfortable as possible. But if there's any fracture, or if there is anything, it could lead to very serious
2 minutes
complications. So
remaining.
our best thought here is to call the orthopedics team and do the X-rays, and check up on you just to make sure that everything's okay. Would that be okay with you?
So, how much will it take?
Well, it really depends on the test results and what the X-ray will show. Let's just hope for the best and see what happens.
So, if there's no fractures, can I go home then?
We still have to assess the situation and see if there is any tear, if there is any dislocation, and if there is any complications from that. So I cannot give you any guarantees until we assess this a bit more and do further tests.
All right. Okay.
Well, I'm really sorry once again. I know you're excited about this. We'll give an idea to your daughter. You said she was coming to pick you up, and we'll support you through this. And hopefully things turn out for the best. Is there anything else that worries you at the moment?
No, thank you, doctor.
Haven't met your expectations today?
All right. Thank you.
Okay.
You still have time. So, how do you feel?
Okay. Okay. This was a simple one, I think.
Yeah, it's simple for you, which
It's
is
not
really,
med-
you did the kids very well.
it's
Okay.
not medically related, so that's the easy thing about it. It's the
Y-
problem is always in the data gathering and the management and the
Yeah,
time differential. So this is
yeah,
quite clear, straightforward though.
yeah. It was easy and straightforward, but the trick is in the communication skills. And your communication skills were very, very good. Okay. That's why you felt that it's okay. But in with some doctors, they will find that no, there's a struggle, especially
Uh,
that the patient is old in age and she was excited to go home, and all of the sudden you tell her that there is a fracture and she doesn't think that this is a fracture. She doesn't think that this is serious. So uh, some doctors will struggle with the interpersonal skills, but uh, you did it really good. What if the patient wants to go home despite you telling her?
well, certainly you're right to decide what's best for you. My job here is to support you either way. I've just explained to you all the possible outcomes and what's medically advisable. In that situation, you just need to sign a form that says that you refuse our medical advice. But that doesn't mean that at any moment you change your mind, you can come back to us. We'll be here for you, waiting for you.
All right, okay. Yeah, and just ensure that she knows that if she goes home
She can come back anytime.
with this fracture, this is unsafe. Okay,
Yes.
this is unsafe. So she will not be able to weight bear. Okay, tell her,
Yeah.
okay, you have dislocation, you have fracture, so most probably you will not be able to weight bear, and this is unsafe for you to go home.
Joint
Okay.
erosion could happen, limb ischemia could happen, and even
Yeah,
nerve tears could also happen. So there are a lot of serious complications.
yeah. Okay. Uh, what I would advise you, just one advice, Dr. Peter. Uh, I like your enthusiasm in uh, in in dealing with the patient, but sometimes some you know,
Empathy.
empathy, all right? This is one of the thing, and slower uh, speed while you are talking, okay?
Yeah.
Especially that the patient is 80 years old, she's old age, okay? So just so you have time, okay?
It's really, it's not something that I guarantee. The time thing, sometimes it run and sometimes it doesn't, and I just don't know. Sometimes a lot of times actually the time really runs away. Especially if there is a lot of differentials, I usually get kind of lost and
Yeah.
think I don't really have things very well, arranged in my brain. So I take some time to think,
Mm-hmm. All right.
and kind of misses the case.
Okay. So I do understand your point of view, but in this case, you had time.
Yeah.
Yeah. So just manage your pace of talking based on the time management. Okay. In this case, you had time and the patient is old. So some sympathy and some, just give me a second. This would give more interpersonal skills marks. All right. But yeah, you've done it really well.
Thank you, Doc.
Okay, all right, right. So let's do the next case. I do not have too much to say in this case.